When does Outperform Cancer get founded?
It took a while. I was floundering because I didn't have a roadmap for my care. Manta Cares did not exist yet. So I was trying to manage my own care and trying to figure out how to navigate the system. And even though I had spent more than a decade writing strategic plans for hospitals and really understanding how they work, it is different when it's your care, and it was different because it was COVID. So there were a lot of rules that were different. Yeah. So I had the diagnosis. This was 2020, and then as soon as I kind of became stable, which was by later that year, so by the end of 2020, I started to ask my doctor, "Okay, what else you got?" And she was like, "What are you talking about?" I said, "What else do you have? I'm a motivated person that can be disciplined. I can take direction. You tell me, what else do I have to do?" And she goes, "I don't know what you're talking about." She's like, "Take the drugs," right? Like in a very nice way, take the drugs and go home, right? And I just believed in my core that there had to be other things that would push me on the far side of the bell curve, right? The bell curve is that statistical curve that says, what your 5-year, the statistics associated with your 5-year survival. And I wanted to live. And I thought, well, there's somebody at the far end of that bell curve. It might as well be me, right? So I started to think about what could I do to get there. And to be honest, I had started looking at that as soon as the diagnosis happened. I was making phone calls and looking at research and things like that. But it didn't turn into something that gelled like maybe I need to keep better records and maybe I need to share what I'm learning with other people. The more that I reached out to researchers, the more they spent time with me. And the more I felt like I'm using the precious time of this person, I need to share this with other patients. And that's when it became Outperform Cancer, because I just felt like it took me so long to come up with what is a robust anti-cancer strategy that was backed up by peer-reviewed research in high-impact journals. What does that mean? It means that we know the research has been deemed sound and good research by the research community. And there's so much noise out there for cancer patients. It took me a long time to sift through it. Now things are getting way easier with AI. What took me 2 months, in 2020 would take 2 hours with AI.
You and I are incredibly similar. Very, very similar. By the way, that basically means that 5 years just happened for you, didn't it?
Yeah, actually 6.
6. I was going to say, I was like, depending on how you count it, because for me it was end of Herceptin, but in my head it's 5 years. But
yeah, I mean, from the evidence so I have no evidence of active disease right now. And I haven't had any active disease since November of 2020.
Wow.
So depending if you count the time that I was initially diagnosed with the disease, which was May, or when we did the scan and showed that, I wasn't lighting up like a Christmas tree anymore. Things went rapidly for me, meaning when I presented with disease, as I said, I had it in my heart. I also had lesions on my skull. I had it all in my spine, in lymph nodes everywhere, in my hips, in my pelvic bone, in my ribs. So there was a lot of activity. But when I got on the drugs and I started to employ all these strategies right away, right? I started to exercise. I changed my diet. I changed my sleep patterns, which previously were not very good. It is still an Achilles heel for me, to be honest, but I did a good job on my sleep. And then I started to identify other strategies that were backed up in research as well. And when I started layering those on. I do think that that helped me to get to know evidence of disease very quickly with the drugs that I was on, but always in partnership with standard of care.
That is awesome. That is awesome. The reason you see me hesitate is I think there's something really powerful in what you just said, not just about the standard of care side, but also you went from being diagnosed with metastatic disease in May to NED in 6 months, 7 months.
I didn't start getting treatment until July 15th. So
Wow.
I actually went 10 weeks without treatment, which that's a whole nother thing. I think it should have gone much faster. But again, it was COVID, so we'll give some leeway there. But it was really happened between mid-July and November.
That is incredible.
Mm-hmm.
And this was all oral for you?
No. Standard of care for triple positive was a Taxol. So I did Paxlotaxel. I did trastuzumab and Perjeta. And then once the Paxlotaxel was done, I was given anastrozole, which is an aromatase inhibitor, to have with the infusions of trastuzumab and Perjeta. And I continue to this day to get that infusion of trastuzumab and Perjeta, and I continue to take an oral aromatase inhibitor called anastrozole.
So you're still on a 3-week infusion cycle. 3 week?
Correct. Yes, that's right.
All right. But you're here.
But I'm here and I'm so grateful. And yes, it's a combination. I think it's a combination of lots of things, but the drugs do the heavy lifting. And anyone out there who's hesitant and thinks, gee, maybe I can do this on my own. Maybe I don't need medical help. Maybe I don't need these drugs. I would say, please, please, please use all the tools in the toolbox. This is not a disease that you want to mess with and not put everything that you have at it right out of the starting gate. You are much more likely to have good result if you really start hard charging from the beginning. And the heavy lifting, you can plus things up for sure, but the heavy lifting comes from the drugs.
Can we talk about the modalities of anti-cancer treatment that you relied on outside of medication? So what I've heard you say so far, exercise, sleep. I imagine nutrition is somewhere in there.
Nutrition is a big part of it. And now I eat fish occasionally, but primarily a vegetarian. I don't have very much dairy. But I don't go so far as to say that I'm vegan because I will have a little here and there. But I'm very considered with what I put into my body. And the reason is that our bodies are one big chemistry experiment, right? Everything we do changes the chemistry. And you can change your chemistry to be helpful for cancer growth or harmful for cancer growth. And I choose to make it an environment that is going to make it really hard for cancer to grow. And there's a whole bunch of evidence supporting that. It says, yeah, that probably makes sense. Right down to stress. So I actually did leave a job that I had as the chief operating officer of a marine robotics company where I helped build this company and it's flourishing. I'm happy to say I'm still very good friends with my former business partner and CEO. But it was a heavy lift. Entrepreneurial ventures usually are. So I took a step back from that to try to keep my stress levels lower. And I also started investigating off-label drugs. And I will say, I think patients need to be really careful about this because there's a lot of bad information out there. But there are some reasons to look at existing drugs to see if they can be beneficial. I'm going to give you 2 examples if I can. The first example comes from a clinical trial called the Patina trial. This trial was first reported, the out of this trial were first reported in 2024 at the San Antonio Breast Cancer Conference. And at that time, they had data that showed that by adding, for triple positive breast cancer patients like me, by adding a CDK4/6 inhibitor, so that at the time was Ibrance in this study. So the Ibrance drug, by just simply adding that drug to my current regimen, that those triple positive breast cancer patients could get a 50% improvement in progression-free survival. That's pretty big. They still don't even have overall survival data yet because people are living so long. So here we have data where we know this is a phase 3 trial now done out of Dana-Farber, high quality research. And we know that if we take an already FDA approved drug called Ibrance that estrogen positive breast cancer patients already use, and we give that same FDA approved drug to estrogen positive and HER2 positive patients, those HER2 positive, triple positive patients get a 50% improved progression-free survival. Now that drug is considered off-label if my doctor was to give that to me right now.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors.